Welcome to the Lymphoma Research Foundation's Early Career Grant Application Guide. My name is Whitney Steen. I am LRF's Director of Research Grants and Initiatives. We understand that preparing a grant application can be an overwhelming process. We hope this video guide serves as a starting point for applicants to our early career programs and answers some frequently asked questions as you begin the process. In this guide, we will cover a brief overview of LRF's early career grant programs, information regarding our special initiative funding, available support resources for grant applicants, and general tips for a successful application, including common mistakes we see from applicants. LRF offers 3 grant programs for early career researchers in lymphoma and CLL, which we define as researchers at the fellowship level or in the first few years as faculty. Our 3 programs are the Clinical Investigator Career Development Awards, or CDAs, the Lymphoma Scientific Research Mentoring Program, or LSRMP, and LRF's Postdoctoral Fellowship Grant. LRF's Career Development Award offers $225,000 in funding over 3 years for clinical research-focused projects and investigators. $70,000 a year must be allocated to salary and/or fringe, with $5,000 a year available for small research project costs or professional development expenses such as travel to conferences, tuition for relevant courses, and other items detailed in the RFP. Applicants must be licensed clinical physicians at a research institution in the US or Canada, spending at least 35% of their time in research. Projects must involve clinical research in lymphoma and/or CLL and should contribute to the development or assessment of therapies or diagnostic tools. Additional eligibility guidelines are listed in the RFP. The Lymphoma Scientific Research Mentoring Program, or LSRMP, is open to both PhD and MD researchers through our 2 tracks, one for clinical researchers and one for laboratory-based and/or translational researchers. The eligibility criteria for the 2 tracks does differ slightly. In general, it is open to fellows and early career faculty, but be sure to review the RFP thoroughly to confirm the exact eligibility for each track. Applicants must be based at a nonprofit institution in the US or Canada, and please note that the LSRMP is our only current early career grant that is open to research at the NIH or other US government entities. Being selected for the program also comes with a $10,000 award that can be used for professional development expenses or any non-salary research costs. The LSRMP's main purpose is to bring early career researchers together with experts in lymphoma research for a week-long workshop in which they work on their research project to refine and develop it further, and also attend talks on professional development issues such as running a lab or a clinical trial team, being an effective presenter, formulating a research question, and working with cooperative groups, as well as key scientific issues in lymphoma research. Following the workshop, participants will attend follow-up programs over the next 2 years and also have the opportunity to attend any LRF scientific workshops during their time in the LSRMP, with LRF covering their travel and lodging. LRF's Postdoctoral Fellowship Grant offers $65,000 a year for 3 years, for a total of $195,000. This award is open to PhD, MD, or equivalent researchers at the postdoctoral or clinical fellow level with basic, translational, or clinical research projects. Applicants can be either MD or PhD researchers and must be based at a nonprofit institution in the US or Canada. Additionally, this grant is not open to anyone who is in a faculty position or has previously held a faculty position prior to the start date of their award. You must still be classified as a fellow when your award begins, but you can move into a faculty position during the grant. Projects may involve any type of research as long as it focuses exclusively on lymphoma and/or CLL. Please be sure to check the RFP for additional guidelines. In addition to funding available for grants of any subtype, LRF also has a number of special funding initiatives that reserve funding for projects or PIs who meet certain additional eligibility criteria. I will share some examples here, but I encourage you to check the RFPs as well as our video on updates for the current grant cycle to confirm the current funding available. Each year since 2021, LRF has awarded grants through its Health Equity Initiative, which reserves funding for projects that focus on health equity issues or PIs who self-identify as being from demographic groups that are underrepresented in medical research. These are listed in the RFP. In the LSRMP, we always have the Conti Rai Scholar for an exemplary project in chronic lymphocytic leukemia. This is an endowed scholar that LSRMP first awarded in 2023 and intends to award every year going forward. It is open to either clinical or lab track scholars. In all of our early career grant programs, LRF also has funding available for specific subtypes, such as follicular lymphoma, mantle cell lymphoma, and DLBCL, or patient populations such as AYA lymphomas. This funding's availability changes from year to year, but will be listed in each year's RFP. It is important to note here that if there are more projects eligible for the special initiative funding than we have funding available, those additional projects will also be considered for the general research funding in that program. As an example, in 2023, we had 3 grantees selected for the LSRMP with CLL-focused projects, and one of these was designated the Rai Scholar. But if you or your project is eligible for one of the special initiative funds, it does give you an extra opportunity to be selected for an award. Now that we've reviewed some of the important information about the types of funding available, let's review the resources available to applicants to guide the preparation and submission of your application. These fall into 2 categories: written materials, such as our RFP documents and our website FAQs, and people you can contact, including LRF research staff, Proposal Central customer support, and your own institutional resources. The RFP for a given program is your #1 resource for understanding your eligibility for a grant, the materials required for the application, and any guidelines on how those materials should be put together. You may also want to refer to the end of the RFPs, as there are checklists there which make it easy to make sure you have all elements of an application put together before you submit. Our grant FAQs, located on our website at lymphoma.org/grants, provides supplemental details to answer common applicant questions that aren't easily covered in the format of the RFP or can sometimes get missed. Additionally, we do sometimes update the FAQs in the middle of the grant cycle if we are regularly getting a new question from applicants, so it's worth checking there even if you've read our FAQs recently. We have also included a sample copy of the policy terms and conditions for the grant on our website. This may be something that your institution's grants office will want to review, as these are the terms that they will agree to follow if you are awarded a grant. LRF does negotiate terms with institutions, so if there are particular terms your institution is concerned about, we can work with your grants office to discuss possible adjustments if you do receive an award from us. There are a number of people who can serve as resources during your grant. We encourage all applicants to reach out to their institutional grants office as soon as they decide to apply for an LRF award. In addition to guiding you through any internal approval processes that might be required, your grants office may also be able to direct you to other internal resources, such as grant writing workshops, previous LRF grantees from your institution, or other helpful resources. You should also make sure any colleagues writing you support letters or serving as your mentor or sponsor are told about your application as early as possible. An important reminder here that your mentor or sponsor must sign the application through their own Proposal Central account, and your letter writers must have submitted their letters in order for you to submit your application. So you'll want to make sure all of that is done before deadline day so you aren't rushing to submit. Additionally, both the LRF research staff, including myself, and Proposal Central technical support can assist you with various questions. The LRF research staff are available to answer any questions that are not covered in the RFP or FAQ, including questions specific to a researcher or an application. For example, if you had international training or a nonlinear path to your current position and aren't sure if you are eligible for a particular program, if you are unsure which program is most appropriate for you to apply for, or if you are not sure if your project falls into the eligible category. researchgrants@lymphoma.org is your go-to email for any grants questions. Note that when it comes to eligibility questions, LRF staff can only tell you if your project is eligible to apply for funding. We can't offer any assessments on how likely the project is to receive funding. Also note that we prefer email to a phone call for eligibility questions because it helps us make sure we are getting an accurate set of details if we need to ask our review chairs for input. Proposal Central customer support is available during East Coast business hours, 9 to 5 Eastern, Monday through Friday, to answer questions pertaining to the Proposal Central application system. If you're having trouble uploading your materials, or your letter writer or signatories can't log into the system, or any other technical issue where the application doesn't appear to be working properly, please contact Proposal Central. PC staff cannot answer questions about the formatting or content of materials. If you can't find those answers in the RFP or FAQs, you can ask LRF staff. We encourage you to make use of all of these resources. LRF staff are happy to answer any of your questions, so we want to make sure applicants are getting the information they need for a successful application. Which brings us to our tips for a successful application. Our number one tip for early career grantees is to keep in mind that LRF assesses applications on both the potential of the applicant for an independent research career in lymphoma or CLL and the strength and potential impact of the scientific project. Recommendation letters should be from senior colleagues who know you well enough to speak to your strengths as a researcher. One common mistake we see is asking the most senior or most well-known colleague in their department to write a letter, even if they don't know you or your research that well. The review committee does read these letters, and they can tell the difference between a letter written by someone who knows you and your specific strengths and someone who doesn't. Make sure your research proposal clearly explains your role in the project, both how the idea for the project was generated and what work exactly you are doing in executing the project as described. If you are working with colleagues, be sure to explain why they are doing certain tasks and you are handling others. Another common mistake we see is submitting a project where it appears the applicant's only role is to coordinate, while the actual research is being done by others. Particularly for early career grants, LRF wants to fund projects where the applicant will be developing their own skills as a researcher. Page limits are important and will be checked. This is actually the first thing the research staff does when the application closes, and we will and have disqualified applications that ignore page limits. We recommend you use the research proposal template that can be downloaded from Proposal Central, as it will help you keep the page limits correct in each section. Be sure to add references or the resubmission section if it is required for your application in the appropriate places. When you get to the keyword section of the application, make sure you make a thorough selection of keywords, particularly in the methodology section. This helps LRF select reviewers who have the most appropriate expertise to review your application. We recommend at least 4 to 6 keywords in the methodology section. Also, make sure your subtype keywords are accurate. If your project focuses on general B-cell NHL, you do not need to select every B-cell NHL subtype, but you should select the general B-cell NHL keyword. I'll also take the opportunity here to show you a trick to make keywords easier to select. If your computer screen isn't showing you the entire keyword, which is likely, they can get pretty long, you can expand the window by dragging from the corner here. I'll wrap up this tips section with some of the common questions the LRF Review Committee asks about applications. If your project timeline is really ambitious, how are you planning to get all this done in the 2 to 3 years of the grant? If you have samples, is it clear where you are acquiring samples from? Make sure any collaborators who have confirmed they are providing samples can give you a letter for the collaborators' letters section. For clinical trials, does your accrual goal make sense? When you consider the patient population in your proposal, if it's a really small population, you may need a smaller accrual goal. If your project is similar to existing studies, how will your project add to our understanding of that area? If your project is looking at a therapy or biomarker that has mostly been studied outside of lymphoma, but existing data makes you think it will be effective in lymphoma. And this is a key one for early career applicants. Are you committed to a future research career in lymphoma? Be sure to include any career plans that will show this commitment. For LSRMP and CDA applicants, you can use the career development plan. For fellowship applicants, you can use the personal statement part of your biosketch, or You can ask your sponsor or your letter writers to talk about activities you've done to show your commitment in their letters. A tip here for those of you who are at institutions that may have a smaller lymphoma or heme malignancy program, mention any plans for obtaining outside mentorship, whether that's attending conferences, joining professional organizations, working with a senior expert in lymphoma at another institution. You can also ask a lymphoma expert elsewhere to be an associate mentor or sponsor on your project to strengthen the expertise you will have access to. So we hope that information provides a little extra guidance as to preparing an LRF grant application. As a reminder, you can always direct questions to researchgrants@lymphoma.org. We also have other videos in this series, which will be added to our playlist as they are available. Thank you, and good luck with your application.